Well, first of all, when you come on in and you're greeted downstairs at the admissions desk, and your family is too, and you're escorted all the way on up to your room, and you change on out, and you come down, and the whole family's together. There is no ifs, ands, or buts. Everything's explained to everybody so you know where you're going. That's a big thing, that nothing comes up and surprises you. You get into the pre-op room, and they get you all ready. The doctor comes on in and tries to put you at ease and draws all over your legs or your hip. I had them both to make sure he hits the right one. We agree on that. It's always a nice thing to do. And then he talks to the family and explains to them what's going on and when to expect for us to come on out. And after that, you come on out and they get you up walking. And they can't beat that with a stick. You're up going around. There's all types of support there. Fortunately, nobody had to grab me. I didn't put anybody in the hospital by me falling down. With the knee, within 2 months, I was back at work. And I was a correctional officer, and I was hauling inmates back and forth and had no problems at all with it. I was totally amazed. And with the hip, there was more problems getting the range of motion with the knee than there was with the hip. And Dr. Piccione had to break out the whip and tell me to slow down, that he didn't want me screwing up the surgery because I thought I was, anatomically correct. So I can't say enough about it. I had no problems whatsoever. Anytime you needed something, you just hit the button and the people showed on up. And they would come in and check on you periodically to make sure that you were fine. You couldn't ask for anything better. And the staff's attitude, I never saw one person not smiling or in a bad mood. And having worked corrections for as long as I had, that was sort of pleasant. So, and still now, whenever I go into the various offices and talk to everybody, everybody's so upbeat. And that's really big. When everybody's upbeat and you're going through an awful lot, you just look at them and say, okay, we can handle this. Well, being a correctional officer, I've hit every hospital in the state. And I can tell you, this is the best. That's why I had it done down here. I have been up to Christiana, I've been to Milford, Kent General. This by far is the best place I've ever been in because of the attention and just the cleanliness of everything. Everybody they're adamant about keeping everything clean. There isn't a spill that doesn't get wiped up almost immediately. You're really, really good about letting us know how to treat our wounds once we leave, and you care about it. So, that's what the classes are for. Well, obviously, God gave me the right genes. I come on back at our Christmas gala, I'll say, and I get to play the jolly old elf. Although I'm not elf size, I do portray him fairly well. Have a great time. Everybody has the same stories, sort of, kind of, and a little bit different. Each time we tell them, they get a little bit better as the years go on, but that's to be said. And I have a good time. It doesn't matter how old you are, how young you are. You can sit on Santa's lap. Santa has had 400-pound linemen from Dell State sit on his lap. So there's nobody you've had that can't sit on my lap. And the knee holds up. If you have to have a joint replaced, this is the place to come. In my experience, you can't beat this. They, like I said, they meet you at the door, they bring you all the way on up, and they take you on out with a hug and away, and don't forget to come back. That's the big thing. You can come back anytime, call them at any time, and they've got an answer for you. I wanted to adopt everybody.